Hi and welcome to podcast here at Samarpan. Today we've got special guests. We've got Gayatri Iyer, and I was talking about my bad pronunciation, and we also have two very, very special guests. Would you like to introduce our special guest there, Gayatri?
So the white girl here, she is Mishka. She's our 9-year-old Labrador, and she's been a therapy dog from the age of 1. So she has a very rich resume of 8 years of working. And this fluffy boy here is Nino, a golden retriever. He's 8 and a little less working than Mishka. He has about 6 years of experience.
Okay, fantastic. So today we're going to be talking about animal-assisted therapy and canine-assisted therapy. Animal-assisted therapy is the umbrella term, as I was earlier educated on, and then we have the subsets of that. So would you like to just tell us a little bit about yourself first anyway, just for our viewers and listeners?
All right. So my name is Gayatri Iyer. I'm a counselling psychologist with 18 years of experience. I also have an education specialist from University of Central Missouri in school counseling. So I do work as a school counselor, and I'm also a trained play therapist as well as an animal-assisted therapist.
Okay, fantastic. So I mean, probably some people are familiar with animals being used for therapy, but maybe you could just sort of give a bit of an overview about some of the benefits of work, therapy with animals, animal-assisted therapy, and of course the types of animal-assisted therapy, because there's a lot more than just dogs.
Yeah. So animal-assisted therapy is one of the terms under animal-assisted interventions, which is the umbrella term. Yeah. And there are multiple things going on in this. So animal-assisted therapy is more of the goal-driven, therapeutic process where there is a therapist, a trained therapist, there's a trained therapy dog, and your client.
Yes.
Right. In some cases, there could be a handler if the animal does not belong to the therapist, or in the case of an equine assisted therapy session where you also have a horse specialist.
Yes.
Because when you're working with the herd, when you're working out into the barn, you do need a horse specialist who's going to be telling you about the horse behaviors, as well as the specialist as well as the therapist who's working with the client.
Yeah.
And IHIO and PET. So IHIO is an international organization which governs animal-assisted interventions and policies and everything. And they have recognized 9 species. So dogs, cats, horses in the order of predominance.
Yes.
Followed by hamsters, guinea pigs, mice. Then you have your chickens and roosters, you have your pigs, you have your goats, which I forgot earlier.
Okay, I forget the goats.
You have your llamas and alpacas.
Yeah.
And you have, I think I said pigs, right? Yeah, yes. I think these about, I may be forgetting an animal or so, but I think there are 9. Yeah, there are 9 species.
Okay. So it's a lot more than what a lot of people would expect, isn't it?
Yes. Bunnies, rabbits, I forgot those.
Okay, I'm a cat man, so I can really sort of for me it'd be a cat would be great therapy for me. So, but anyway, on a different note, and let's talk a little bit about working with dogs.
Yeah. So imagine that you walk into a therapist's office, right?
Yes.
Especially children. Children have been told don't talk to strangers, right? Or whatever happens at home, you don't talk to other people around, especially in the Indian culture.
Yes.
Now, and sometimes things happen that the child has to go and meet a therapist. There may be disturbances in school, there could be emotional disturbances at home, etc. So, when you walk into a therapist's office and this child is like, that's another adult.
Yes.
Right, who's going to tell them no.
Yeah.
Or it's going to tell them don't.
Yes.
But that adult's office, you walk in, there's a bunny, or there is a dog, or there's a cat, or there's a fish tank, right? And the child is seeing, oh, this person is interacting and the animal is so in love with them, or the animal is willing to interact with this person, so they think this person may be cool.
Yes.
They are not probably your typical adult who's going to say no and everything. So that brings down the anxiety level for children. Even for adults, when they don't have a fear of they don't have fear of a dog, especially if they are working with dogs. They don't have fear of dogs and they like dogs. The presence of animals, when they give you so much unconditional love and unconditional acceptance, the presence of animals itself can be very healing and can bring down a lot of your anxiety.
Yeah.
Right? So rather than, and especially if the therapist tells you, even if you're not comfortable talking to me, you can go and talk to the animal. So stroking the animal and talking to them, you immediately feel your anxiety draining out.
Yes. Okay. So I mean, obviously, with a dog, some of our clients. I mean, what are sort of some of the main presentations that you get with clients that come to see you to sort of work with and have assisted therapy?
So we worked with a variety of clients from all age groups, age 3 onwards to age 80.
Okay.
And whether so I also do animal assisted play therapy, where I'm combining the play therapy aspect with dogs. So
Yes.
my children, when they come into the playroom, they are getting the dog and the toys.
Yeah.
Right. So that can be one aspect where you are using animal assisted therapy. The other aspect can be when you're working with any of the creative arts, when you're working with people with all sorts of issues, except for maybe a psychiatric illness, right? You can. So even for substance abuse, you can
Yes.
incorporate dogs or cats.
Yes.
Especially for geriatric people, because they so love that soft touch. And it really helps, because when you're stroking the fur of an animal, actually when your joints are stiff, they actually loosen up. That's stroking. So that really helps even for geriatrics, for hospice clients.
Yes.
So animal assisted therapy or animal assisted intervention can be used for a variety of things. In US and other few European countries, dogs are also allowed into the pediatric wards, cancer wards, where they bring a lot of happiness and joy. They use, again, not used, for pain management, right? Like some of these procedures, surgical procedures or any other medical procedure, can be very painful.
Yes.
And can be scary. So when there's a dog or a cat or a horse coming to the hospital and you meet, it brings about so much of joy. And animals can be very entertaining. When they are asking them to do certain tricks or something, or they just leap onto the bed, people start laughing, smiling. So
yeah, I mean, I guess, certainly in sort of the environments I've worked in over the years, we've always tended to have some animals present. I'm not saying that we do like necessarily therapy, but there's a huge therapeutic benefit from having animals sort of, at the rehab, we've got a couple of cats. We haven't got dogs, but, but we've got cats. And I from my experience, the clients, they actually really like having the cats around.
Cats are small. You can just pick them up if they like being picked up. You can put them in the lap.
That's a cat. Yeah. I mean, that's.
We can do it with the smaller dogs.
Yeah, I mean, we had, at my old rehab, we had cats and dogs. But again, they were more sort of, part of the they weren't necessarily therapy. We unfortunately had monkeys as well, and they're not really very helpful. Okay. So I mean, in India, how common? I mean, are there many people sort of practicing animal assisted therapy?
There are quite a few practicing. And they've been practicing for quite many years.
Yes.
They have way more experience working in this field. But it does becoming a little challenging in India because, one, not everybody is open to the idea of animals can treat us or animals can help us in the whole thing. India is inching towards becoming a more pet-friendly place. At least in the last 5-10 years, there's been a shift.
Okay.
But we need. But the thing is, it's very strange. We are coming from a rich culture where animals were treated. They are messengers of God, or that mythological aspect is there. But when it comes to our street dogs, street animals, then it just becomes another complete hurdle.
Yes.
So we are trying our best, especially we are in talks with one of the very premier institutions in India of having a project where our street dogs
Yes.
or indies are going to be trained into therapeutic mediums.
Okay. That sounds like a fascinating opportunity, and also to deal with maybe some of the issues that happens.
Yes, so we are hoping
Yeah.
to remove the stigma against our street dogs.
Yes.
And they are a valuable resource because they are available in plenty. So, rather than getting really expensive breed dogs, train them, etc.
Yeah.
For me, I was lucky I got them through adoption, and they were very suitable for therapy. But that can always not be the case.
I was going to ask that question because a lot of people would assume that a therapy dog would be a specific breed,
There's never like that.
Yeah.
So even in the US, just 1 second, can you just pause? Okay. So even in the US, if you see last year's ASPCA Therapy Dog of the Year is a deaf pit bull.
Okay.
So it's never the disability, it's never the breed, it's never the age, right?
Yeah.
She's 9 and going strong. She loves being in therapy.
Yeah.
So she's also got her own health issues, like she's got arthritis, but that doesn't stop her from working.
Yes.
And sometimes when you have to work with geriatric patients and you're telling them, see both of them, they have their own health issues and they still pushing through, they still love working.
Yes.
That gives them a motivation.
Yeah.
Right. So coming back to your question about, sorry, what was it?
I think we were talking about does it have to be a specific breed?
Yeah, does it have to be a specific breed? It doesn't have to be.
Yeah.
It's all about the temperament. It's all about how you raise them.
Yeah.
It's all about the training that they receive, right?
Yes.
So ideally, if you're going to get a puppy, whichever breed it is, even if you pick them up from the streets, get them their early socialization, get them used to all sorts of sounds, all sorts of people, whether there's children, whether there's people, whether there are people on crutches, whether there are people on wheelchairs, whatever it is, getting them used to different kind of sounds like the school bus or different cars, scooters, whatever it is.
Yes.
Getting them more and more socialized, allowing them to interact with other dogs, that helps you raise a very confident dog.
Yeah.
Right? Yeah. We don't want extremely shy, timid dogs, and we don't want dogs who are going to be aggressive. We don't want them in therapy, right? No. Because we are going to put a lot of people at risk, not only your dog, you're going to put your client, yourself, everybody's at risk, right? And first, we'll always look to our dog. We have to be their protectors first. So the breed is never important. It's the temperament. There are temperament tests to see. Like when you pick up the puppy and you put them upside down, are they willing to be kept down like that? Are you, if you hold them in your hand, are they willing to be staying there?
Yes.
If you go to the playpen and you call the puppy, is it willing to come to you, right? So you can do multiple tests like that. There are temperament tests, and then you go for your basic obedience courses. Again, it's never about how many tricks my dog knows. Is my dog willing to be around people?
Yes.
Is my dog comfortable even in loud situations? So when we go into colleges, when we went to the conference, it was loud. It was a very small place.
Yes.
There was too many bright lights.
That's right.
But Mishka was absolutely comfortable because again, she's worked so many years, so she knows, right? I don't even have to tell her what to do in this situation. She just does. Like Nino also. So we want dogs who are willing to be and willing to work.
Yes.
At one point, if Mishka will tell me very clearly if she's done with the whole session.
I was going to ask that question because it's sort of it's like they're working dogs.
Yes.
No, humans are temperamental, and I was going to say, sometimes is it where you turn up for a session and the dog is like, I don't really want to do this.
Yes.
Yeah.
So I think you saw it at the conference that, though Nino came in all hyped up and wanting to be there, at one point he decided, I don't want to be on the stage, and he just went to the side. Yeah. Right? And that's part of therapy. And that's again a teaching moment for us to teach our clients, that's okay, that's their mood and we have to respect that. And as humans, as you said, we have our moods.
Yes.
We want, I'm not going to take part in this, I'm going to take part in this.
Yeah.
Right? So they also have the same thing. Mishka, when she first started working, she was working for children with disabilities in a group session.
Yes.
In a special school.
Yeah.
And it used to be 45-minute sessions where 4 or 5 kids.
Yeah.
And usually by 35th minute, she's like, I'm done. I used to go to near the main door, and she's like, I'm done. Let's go.
Yeah.
You know. So we used to say that this is the moment where you can take a break. You know, we give her a water break, or we
Yes.
just take her out for a walk,
Yeah.
or we just allow her to play with the ball for some time.
Yes.
And then bring her back into the room and ask her, do you still want to continue?
Yeah.
And if she stands at the door, says nothing doing, I will not enter, then we just end the session.
Yeah.
If she's willing to come back again, then we just finish the session for the day, and that's it.
Yeah.
You know.
Yeah.
And then we don't keep a session for say a couple of days so that she can just decompress.
Okay. Okay. I mean, how many hours, or how many hours do they do working sort of in a week, or in
So ideally, it should not be more than 2 hours a day.
Okay. All right. That's interesting.
Yeah.
I never knew that, so I've learned
Because
something. Yeah.
they're also like sponges. They are absorbing everybody's emotions around them, right?
Yes.
So even in this room, there are 3 of us. They're absorbing. Even though he's sleeping right now,
Yeah.
he's still absorbing. You know, when he was outside meeting all those people running around there,
Just enjoying. Yeah.
So there were points when I think one of the ladies outside, she clearly said, you know, she's afraid of dogs. She was standing there.
Yes.
And I told him a couple of times, do not go to her. So he would go up to her, and then 1 feet away, he would turn around and come back to me.
Yes.
Because with others, he was actually touching them. He was, you know, allowing them to pet. But with
Yeah.
her, she was keeping that one feet distance. Right?
Yeah.
So Mishka what she would have done when she was younger, now she doesn't do it so much. She would just turn her back and just show you her back and sit down if she knew that you're afraid.
Okay.
Right?
So for example, I mean, I've got a colleague, and Obi, who's the director of the rehab centre, and he's not too keen on dogs. So, and I keep saying to him, maybe you need to sort of go for some therapy. You know, what would you be saying to Obi at this point? Because he'll be watching this, not today, but when this goes up.
I will tell you. So we did. So Nachiket Deshpande, who runs Dog Ad Therapy,
Yes.
and I run Positive Synergies. So we did in between. We did run a program called as Cynophobia. So cynophobia is fear of dogs.
Yes.
And how to work through that, and we did systematic desensitization and a little bit of flooding. A lot of behavioral techniques were
Yes.
used.
Yeah.
A lot of mindfulness techniques were used, and we did it about 10 sessions with him.
Yeah.
Now, this was a guy who told us he was terrified of dogs to the extent that he would just go numb.
Yeah.
He didn't have a phobia, but he was terrified.
Sure.
Okay, and we did it at Pet Ashram, which is a dog boarding place that Nachiket runs. So obviously there are going to be dogs there,
Yeah.
right? And that's the environment that he wanted to work at.
Yeah.
On his fear. So we brought him there, and he used to be so terrified. He used to tell us, Nachiket and Gayatri, please see that all the dogs are locked up. None of them are running around. I'm just entering like 5 minutes early. He would just give us a message. So our dogs used to be in the lodging facility. They're all in their crates, everything. Even our therapy dogs were not there because that was the level of his fear.
Yep.
And then we slowly introduced him to Mishka and Nino. We introduced him to a few of our other gentler dogs. So it came to a point where he would just sit in the open area, and there would be 4 or 5 small dogs running around.
Yep.
And he could stay calm. Like earlier, if I had done that, he would be like trembling. You could actually see him trembling and very fast heartbeats and everything. And it got to a point through a lot of all these activities that he could actually hold a dog and sit on his lap.
Okay.
Right. His main fear was street dogs, which we were working at.
Okay. So there's hope for Obi then. I think we're going to probably,
we'll
have to. It's a shame he wasn't here today.
Oh, these two are experienced in working a lot of, even in my, our friends groups, my father's elder sister, she's terrified of dogs.
Yeah.
And this was when these two were far younger. She was, I think, 3 and he was 2. And she came into our house and we were like, you just come in, aunt. You just come in and you sit here. within 1 hour, she had both of them sitting right like bolsters,
Yes.
right next to her.
Okay, well, there we go. We're going to...
Just introduce Obi to,
Yeah.
I think, Mishka, and that'll be fine.
I would have liked to. It's a shame he was not here today. He was here yesterday,
Oh, okay.
and it would have been great if he'd been here today, just to see. And
We could have done a live
Yeah,
session.
we could have actually done a live demo, couldn't we? Could have used Obi for that. Tell me a little bit about. I mean, you've talked about some of the stuff that you do, but obviously a lot of people are unfamiliar with the use of animals in the therapy process. When just before you came and I was saying there was a couple of dogs coming in, like, what? Well, why? And then I'm saying, well, they're actually therapy dogs. Is there really therapy? So, could you maybe explain a little bit about sort of the training and I'm assuming that there are specific training courses that people like yourselves do, and if people are looking for animal-assisted therapy, they need to be looking at certain professionals, not just. And the reason I say this is because there we go.
She just wants to be somewhere else.
Yeah. Hey. So. Yeah. There we go. So.
She wants attention.
Yeah. One of the reasons that I say this was that about a year ago I was having a conversation with a professional. I won't say what they were because I think that probably sort of give it away a little bit too much. And we was talking about different types of therapy. They were up at our rehab and he asked me a question of like do you do these different therapies? Da da da. And I was like, yeah, we do this, we do that. And he was sort of saying, oh yeah, we do this, we do that, we do this, we do this. It's like, oh, you do a lot of stuff. And so he then said, well, he said, do you do equine therapy? And I said, well, no, we don't do equine therapy. He said, I do. So I said, oh, brilliant, I said, well, where did you train to do it? Because it is quite a sort of a skilled,
specialized area.
Very specialised area. And I've got a few of my friends that are equine therapists. We've had a couple that, from Camino Lodge in Spain, Camino Recovery in Spain, who have an equine program within their rehab centre, so I'm sort of a bit familiar. He said, yeah, I watched a few videos on YouTube, and he said, I got a horse and I watched a few videos on the YouTube, and I thought, oh, okay. So I'm just sort of asking, you're laughing, but I mean, there's a serious part to this.
Yes. There are so many ethical violations here.
Yeah.
So first and foremost, you have to be trained as a mental health professional.
Yes.
Right? Whether you are a psychiatrist, whether you are a clinical psychologist or a counseling psychologist, speech language therapist, any mental health professional, paraprofessional is fine.
Yes.
Right? Psychiatric nurse can also be.
Like me.
So, so one is that, and then you get your certificate courses, or as I was telling you, in Israel they actually have a 3-year program in animal-assisted psychotherapy. So usually it's more in Europe and US. They have the more standard programs. We've been running for years. I was trained in the US at University of North Texas under Dr. Sitya Chandler.
Okay. Yeah.
And it was a university level course, so we had a whole semester's course where we did animal-assisted therapy. And I did get to work on projects with her. We also had supervision under her. So that is mandatory, that you do a course and get supervision and get some internship experience. I did get to work at Pause for Reflection Ranch, which is in Texas. Where we had miniature horses, we had horses, we had donkey, who was a most interesting character.
Okay,
Beautiful, beautiful animal to work with. Rabbits, and of course our therapy dog Watson was allowed to come in. And they had also chinchillas, and I never got the idea of how to work with chinchillas. They're a South American animal, but not in the 9 species. So, but that place had it. So those are the experiences that you need you know, getting to work with multiple species, getting supervision for it,
Yes.
getting a person who is really, what do you say, trained in the field. So I was
Yeah.
trained actually with two people.
Yeah.
One is Dr. Cynthia Chandler, and I also did my level 1 of animal-assisted therapy under Dr. Risa Van Fleet, who is the pioneer or the person who started animal-assisted play
Yes.
therapy.
Yes. Yeah.
So I did get to learn under both of them.
I mean, it's interesting because I had this discussion with one of your colleagues, well, not but one of our colleagues, Rupa, about sort of the whole thing around about licensing and all of that, and I was sort of curious to see, you know, what are some of the challenges that happen in India at the moment that, you know, as I said, I've given you an example of a person that had a horse and then you know, watched a few videos on YouTube and now claims that they're an equine therapist. What?
So the other people who've been practicing in India, I think a few of them did Dr. Cynthia Chandler's home study program. So it was a correspondence course program they did under Dr. Chandler. I trained under her directly. And some people may have done it from other places in the US. There are a lot of places. You have Dr. Fine teaching it from California. You have Dr. Linda Stewart who teaches it from Idaho. So there are a lot of programs in the US.
Yeah, it's a lot more common in the US, isn't it?
You have the whole Gestalt equine assisted therapy course. Then you have Pathways, I think Path or Pathways. There is one. So there are proper equine assisted therapy courses that run in the US. I'm not very familiar with the UK ones. So India ones are again people who've been trained either outside, they've come here and they are training other people. And Nachiket, Zai and I are also planning our own course. We hope to get that out soon, where we will train. So Nachiket was trained in the UK. In animal-assisted therapy. And I was trained in the US. So we are trying to bring those ethical standards and you know, whatever we've learned from those pioneers and those top people.
In Mumbai alone, how many sort of people? How many have you got in your organisation working as?
So currently the three of us. So it's like three different organizations we're together. So I'm from Positive Synergies, Nachiket is from Dogat, Zai is from Synergic Minds. So we three have been working and collaborating on multiple projects. Zai and I know each other for almost 10 years now. We did work for Animal Angels Foundation for a few years. So there is that. Then you have the Dear Oliver Therapy, which is run by, I think, not Radhika. Oh, I forgot her name. Sorry, yes, Radhika Nair. And then we met Janvi, who was trained under Radhika, who also was one of the panel members with us. So she practices in Mulund. Nachiket and I practice mostly out of Thane at Dr. Vilona's clinic. And Zai practices it with us whenever there are big projects.
So there's nothing really down in this end of the city at the moment?
This end of the city, I'm not really sure.
No, clear.
That was telling Miranda that anytime you want us, we'll bring our dogs. We have a team of dogs, so we'll bring them.
I mean, I think sort of, you know, we definitely at some point also, you know, maybe get them up to the rehab as well. You know, I think it's quite cool. I think sort of, you know, I mean, I always sort of see, you know, when animals come, when you have animals or whatever, that, you know, people are sort of generally they sort of light up and we used to, I mean, the hospital that I trained in back in the UK, I mean, we actually had well, we had a farm, but I mean, we had sort of pigs, goats, cows, all this sort of stuff, you know, and it was and the, you know, and the patients loved it, you know.
So we are hoping for a facility like that. Since I was, you know, trained at Pause for Reflexive Ranch, which had so many species of animals, My dream is to go to Green Chimneys in New York, which was on the same basis, like with a lot of rescued animals were brought in.
Yes.
It's a huge farm, and then now there are children who have emotional issues,
Yeah.
behavioral issues, who come there, residential programs.
Yeah.
They work with these animals, they work with therapists there.
Yeah.
So we are also in talks with a place which is a little off Mumbai in Baramati, but that's a rescue center for cows. So we
okay.
are planning something that we can work, so we can help people connect back to nature, because it's a working farm.
Yes.
And it's also a rescue center for cows and bulls and buffaloes and all. So we visited it once, and it was an amazing experience.
I'd imagine. I mean, these like rescue sanctuaries are amazing, aren't they? I mean,
And cows are, like there were a few calves there whom I met, and I could not differentiate between, is this Nino in a cow farm, because they were just so exuberant and wanting that affection and of wanting that touch and wanting that
Yes.
connection with you.
Yeah.
And if you go to the US, cow hugging is what, like $100 an hour or something.
oh really? I never knew that.
So my father's ex-boss, he's the one who connected me to this, and he's like, they can pay $100 for cow hugging in the US. Why don't you do it here at the rescue place? And I was like, yeah, we will do it.
No one's going to pay $100 though in
No,
India.
it will be $100, but we'll make it a little bit more feasible to Indian economy.
Yeah, I mean, I get. I mean, cows are very. I mean, they're actually a really nice animal. I come from the countryside, so I mean, walking. If I was to walk outside where my home, where I'm in fields with cows, literally within sort of a couple of minutes. I've always been familiar with sort of cows and stuff. Here it's a little bit. You have cows walking through the street. I mean,
and it's a sad thing here.
Yeah. I mean, for and you talked about behavioural difficulties and stuff. So I'm assuming that a lot of that stuff is around working with children, particularly. So, how does that work, or how do you work with a child that's got some behavioural difficulties with I'm sure there's families that sort of.
Yeah. So again, like there are things that a human may accept, my animal may not.
Yeah.
Right. When we are also talking about rewards or reinforcements, certain things work with animals, and for children especially, they are live examples.
Yes.
They are live models.
Yes.
Right? I had this 4-year-old child. When he was 4, he first came to me, and now he's come back after a long period of time. When he was 4, his parents brought to me, and at that time, Nino was just about 6 months or a year or something. He had not fully come into therapy.
Yes.
Because you cannot take in animals which are less than 1 year old.
Okay.
Okay. And Mishka was already working for the past couple of years or something like that.
Yeah.
And what happened was, when the child was brought, they had brought him to my house. And there was something that happened, and Nino was just not listening to us for something. So I just said, Nino, you have to go back into the room. You're not being allowed to be part of this event or activity, whatever. And only Mishka will be there.
Yeah.
So for that half an hour, the child got to play only with Mishka.
Yes.
And Nino was sent back because Nino was not listening to us.
Yeah.
And the parents told me, you didn't intend that, but that gave us such a strong message to the child. That, when Nino was not listening, he didn't get to take part in the activity, which was so much fun.
Yes.
So the child also lost the opportunity to play with Nino. Nino also lost the opportunity to play with the child.
Yes.
Right? And the next week, the reverse actually happened. Mishka did not get a chance because she was not listening. So that was like a double thing for the child, where, that lesson was very strong. When I'm working again with my child clients, as I said, a lot of rewards. They love feeding them. They love taking them for a walk.
Yeah.
So when they are taking them for a walk, I tell them, to be gentle. You cannot pull them too hard. Dogs like to sniff wherever they are going.
Yes.
So they're not going to, listen to you. Give them a few seconds to sniff. So you're teaching them patience. You're teaching them tolerance.
Yes.
Teaching them respect.
Yes.
Right? And the children, when they come back, they immediately like, oh, I'm seeing Nino is panting. Can I give him a bowl of water? Can I give him a treat because he was so nice on the walk? So that empathy is coming in. They're not natural.
Yes. Yeah. So it's that reciprocal Well, it's almost like, yeah, I mean, sort of learning, modelling, whatever you want to, yeah, it's really interesting when you say that the child can pick up, oh, they need, you know, whereas maybe in the family dynamic, they don't have that necessarily, when they're in the family, they don't necessarily have that empathy, or they would pick up the cues that someone wanted something, I guess.
Even with adults, so this happened recently, I think just last month. I was talking to one of my clients and he has some, you know, self-esteem issues and depression stuff, and at one point what happened was Nino just turned over towards me and he was like, am I boring the dog so much, or what am I saying, the dog doesn't like it or something like that, and he made some powerful statement.
Yeah.
And I said, I just stop here, you know, just stop here and think back on what you just said. Like the statement that you made, and that was just an unintentional thing probably from him, but you took it so personally, right? And I could immediately go back to his self-esteem issues. I could go back to his self-image issues to it.
Yes.
And at one point what happened was Nino again turned back to him.
Yeah.
So I was like, now what does it mean to you when he's turning back to you?
Yeah. So yeah, you can then apply some of the CBT stuff around that and around about cognitive distortions and
you can do CBT. I use mainly humanistic, so I use a lot of conditions of worth and all those things.
Yes.
So you know, you can immediately, and this is a live example, right? As a sentient being who's showing their emotions, whatever it is.
Yeah.
So that happens. And he's a very gentle soul.
Yeah. Hello.
This is what he does in sessions. He goes to sleep.
Okay, fantastic. So, I think we've been talking for about 40 minutes. So, you know, is there anything that you would sort of feel that's important for people to understand about the work that you do? Is there anything that you feel that maybe people don't or misunderstand?
So one is, I'll just tell you a few challenges. So one, when we are working, you know, people like dogs, how can dogs, you know, be working, and you're saying you're working with dogs, etc.
Yes.
Or animals. So, you know, that becomes a big challenge for us.
Yes.
But once they start working, we say, you know, just try for a few minutes or try for a few sessions or just come for a meet and greet. And I say, oh, this was so good, why did I not try it earlier? Right? Or I heard it from someone and I was skeptical, and when they see what's happening or when they see the difference happening,
yes,
you know, we have so many clients whose parents are afraid, but their children want to be with animals. So
yes,
the parents are like, we've never even seen these kind of behaviors in the children. What are you talking about? You know, immediately going and picking up a bowl of water for the dogs, whatever it is. We've not seen these at home, but they're ready to do it for the dog.
Yes. Yeah.
Right. So there's some skepticism. We have to just keep doing a lot of awareness for it, and I think this will be also a really good awareness opportunity for us.
Yes.
Another thing is, you know, distances in Bombay. You know, the traffic and everything. So
it's horrendous.
Yeah. I mean, the dog is supposed to only work for 2 hours, but 2 hours only go in traveling, or 4 hours in traveling, right? That becomes, because then our dogs get tired. A lot of times, like for me, I've been extremely lucky that both my dogs have been therapy dogs working with me.
Yeah.
But many times we have to take in dogs from others, like Purple, when she came to the conference. She was somebody else's dog.
Yes.
And so that becomes a problem that, you know, the pet parents are like, how do we transport the dog?
Yes.
How do we bring the dog to that place?
Yes.
So we try, when we get projects, we ask for transportation costs, so that at least we can pay our pet parents for that much.
Yeah. Yeah.
And then again, it's the commitment thing. How willing are the pet parents willing to commit?
Yeah.
Many people have excellent dogs, and we always, you know, whenever we see a good dog, we always go and talk to the pet parents and like, no, we don't want this, or you know, that is too much effort.
Yeah. Whatever.
So that does become a challenge for us.
Yeah. I guess, you know, that other part about skepticism, you know, that's not just with animal-assisted therapy here in India either. I mean, there's still a lot of skepticism around about therapy in general, isn't there? I think I mean, you're a psychologist as well.
So ours is a double obstacle.
Yeah. So you have a double obstacle. Yeah. I mean, not necessarily talking about animal, but what changes have you seen in the last sort of, in the last sort of 10 to 20 years, when people starting talking around a little bit more around about mental health here in India?
When I first started into this whole journey of psychology almost 20 years ago, there was not so much of awareness. There is still skepticism. Like, I just had a client on Thursday, and you were like, will therapy ever work? And you have to put in so much effort and all these things. They were questioning me, and I'm like,
Yeah.
Try for 10 sessions. 10 sessions is 2.5 months.
Yes.
Right?
Yeah.
One session a week, something like that.
Yeah.
So I said, you can put in that much effort. I'm not talking to come for a year. I'm not telling you to come for 2 years.
Yes.
10.
Yeah.
Right? 2.5 months. And it's like, taking any antibiotic, you have to take it for some time for the actual work to happen.
Yes.
Right? It has taken 20 years for the trauma, for all this mental health issue to develop.
Yes.
You cannot expect it to go off in a day that you meet a psychiatrist or meet a psychologist. It's going to take time.
Yeah, I mean, I've noticed at times that's a sort of an expectation is that the doctor is going to give me a tablet and it's going to cure it. I mean, there's that whole part, and I think when if we're working with people with maybe trauma and long-standing other mental health issues, that it's not necessarily going to just be a tablet that's going to resolve the issues. It's going to be a process, and people do struggle a little bit with that.
So the awareness that has come in from the last 10 years or so, people, whether it is Indian athletes, international athletes, Indian celebrities, they're opening up about their own mental health struggles.
Yes.
And they're opening about going to therapy. I think a few, even representations, though some of them have been really bad, but representations in media about people going in for therapy, I think that does help make people think that, okay, it is, right? I would say our education, our boards, our education minister at least took that whole stand that all schools should have a school counselor.
Yes.
Now, that's a big shift. It was not there when I was in school, right? Now it's a mandate. That all schools should have, and that brings us to such a thing, because parents are now relieved when parents come to meet me for PTM. They're like, thank God there's a school counselor, there's someone my child can go to. Right? Teachers come to us like, hey, what do we do in this situation? Can you give us some classroom tips? So I think that does help in bringing down that whole stigma against mental health. And mental health is not only when in Hindi we have a saying, right? Pani sar ke upar se chala jayega, means like when the water has just gone beyond, you don't wait till that extent. You can just go to a psychologist even to know yourself, to know what are my strengths and weaknesses, do a SWOT analysis, to do a career analysis, whatever it is. So I think more and more people are now opening up, especially the younger generations. They are more opening up about, okay, if you have to figure out life, then we go to a psychologist.
I mean, I'd sort of notice and sort of, just when you sort of go online now and you sort of see more people talking about it, even, I mean, obviously I follow stuff because I live in India these days, but, I can see that there's, the younger generations are a lot more, sort of seem to be a lot more open to talk about stuff now, which I guess is a good thing. The more people that start to talk about it, I mean, it was no different, you go back to the UK 40 years ago, same issues where people didn't want to talk about certain things. So it'll take time here, but I think it's good that, people are.
There's I would say there's more of an international increase in awareness and the need for mental health, and mental health is almost getting the status of like not only physical health but mental health, or both of them are equal. So it's reaching up to that status, and that's really good.
Just a couple of questions before we finish. What about COVID? Did you sort of notice anything sort of after COVID that that you've seen more happen, to find more clients coming?
So COVID, so I was not here, I was in the United States. But I did hear from my Indian friends who are practicing in the mental health field. They said there was an upsurge because people were at home, there was so much of tension going on, their relatives themselves having COVID or being stuck at home. If you're an extrovert and being stuck at home, that could be like major thing. And India had severe lockdowns.
Right? It was pretty severe, wasn't it?
It was not the case in the US. Barely we had any lockdowns. So I think here there was an upsurge. There was an upsurge even in wanting to talk to somebody. And that wanting to talk to somebody ended up with a therapist, with a psychiatrist, with a counselor, with somebody, right? Somebody to listen to me. I'm ranting, I'm climbing the walls, whatever it is. So that I think helped creating more awareness. And that's continued. And there have been a lot of issues because of COVID, school children especially, a lot of people who are just, fresh out of college or who were in college when COVID happened. So they're still learning a lot of learning a lot of social skills which they missed out for 2 years. So I think a lot of things have happened for the positive with COVID, but
there's I mean, I think, I think that's a good point you make about a lot of children lost time, being in the school environment, being with their friends, being sort of all of that stuff, and it has clearly had an impact on that, as you say. But there's also been some positives that have come where people have started to be able to reach out, online therapy, those types of things, where people start to sort of access that as well. So it's become a little bit easier.
That's a very good question, because access, like. Earlier, there were only the major metropolitans or major cities who would have a few mental health professionals, etc. But with telehealth, I think NIMHANS had opened Telemanas, which is this, you can just call people and talk to them. And they have gone to remote towns. So they've made therapy more accessible, financially also, and on the telephone or on the internet. So they have made it more accessible that way, and I think that is more urgently required, rather than only concentrating on urban places, or
because it's not always realistic that you're going to be able to have someone in some of the remote locations, isn't it? I mean, that's a big issue,
right? So if you can offer them maybe a telephonic conversation, you can offer them maybe on the internet. I don't know how good the internet would be at those places, but at least on the phone, if they can talk to someone for 15 minutes, that can save lives.
Yeah, absolutely. I mean, I think, my experience, I mean, obviously the US, telehealth has been big in the US for a long period of time. And, I mean, sort of, online therapy, online group therapy, online intensive outpatient programs, things like that have been going for quite some time in the very sort of, matured, and more so even after COVID. I think even more take up sort of, COVID during that time. I mean, I go back, like you say, if someone has got some degree of access, it can save lives, that ability, even if it's a telephone, that they can pick up a call and speak to a mental health professional, even for 15 minutes, sometimes that's enough in the moment, isn't it?
Yes.
Okay, I'm really sort of, really grateful for your time.
Thank you.
And, I think for anyone that is looking for different therapeutic approaches and with animals, who do we contact?
Positive Synergies.
Positive Synergy, okay. And hopefully we're going to see the dogs back down here again.
Anytime.
I think Miranda's quite keen, and maybe we'll have to get Obi. We'll have to get Obi into therapy.
Oh yeah, we probably need to record that for you.
We could have a recording of Obi working with the dogs.
So maybe with this podcast we can put like a live demo right there.
Okay. So thank you very much.
Thank you so much, Martin.
Thank you.